Tuesday, January 14th. Meeting here in the Slade Building, Board of Health meeting. We have a quorum, so we will go forward with our meeting. And and of course, this meeting is being recorded and will be broadcast. First on the agenda is a review of the December 10th minutes, and any comments or corrections that you can see? I make a motion that we approve the minutes as written. Do we have a second?
I'll second.
Okay, and we're all in favor? Okay. Minutes passed. All right. Sign off on this.
I have 7-Eleven right now on my phone.
Huh, my watch is off.
No, we don't.
Okay, so the meeting actually started probably 2 minutes ago, 7:09. Sorry, my watch, I guess, is, it gets fast over a year, apparently. Okay, COVID-19 flu Maven update. Judy is still doing Maven reports. COVID-19 statewide is up. They know that from sewage water testing that they do in the bigger cities. And the hospitals, it came out to all the hospitals and medical facilities to encourage staff to be masking, and most hospitals are doing that now. So we continue to have free COVID tests available during the hours when the town offices are open. I see we're out of them here. No, yes, we're out of here again. But we do have free tests for anybody. Probably should check the senior center again too, see if they have any.
Claudia usually comes over.
Oh, okay, so, if people need to self-test, that we have tests available. Flu, I don't have a report from the schools at all. Have you heard much with your children in the
No.
elementary school? Any announcements or anything?
I'm just
coming
double
through?
checking for a newsletter here.
Okay. Next, on the agenda are Title V/perk tests. The first one is 15 Rawlingswood Road. The Title V fails. And so this would be for a repair.
This is the one that they kind of did backwards. So
Right.
we're just reviewing the Title V.
We're just reviewing the Title V at this point.
No, the last newsletter from the school was in November.
Okay, nothing, no.
And there
current
was no
updates.
reports of anything.
Okay. So it had a back, if I can work this with a paper clip to save us a little time. It shows that there was a backup of sewage into the system component due to overloaded clogged system, so therefore it failed. There may be other indicators as well, but we have tons to look at, so the paper clip shows up. And when that fails, of course, the test fails. We have 148 New Templeton Road, Title V passes. And then I'll take that one back and say that it was reviewed. Let's see, paper clip or something else. And the last one is 205 Gardner Road, Title V fails. That's that. Title 205 Gardner Road will be a septic repair.
So that, Luke had sent to Brian, so they've already paid for a perk test because
Mhm.
this failed, but what does that say?
Corrected page from,
Okay, cause he had, I caught something that he checked off wrong, so that's the corrected page.
okay. But on this corrected page, which I'll put a paper clip on, there was static liquid level, in the D box, due to an overloaded or whatever's clogged system. And the system failed. Wow. It's an old cast iron tank, so that'll probably be replaced as well when the time comes. And, they're also doing a new perk, to figure out where to put a new drainage field in, since it is not, multiple reasons it failed. But this is the paper clip area. This is that. This one goes here. We're gonna do this one. Okay, there's that one. We also have water tests, from HCS, which is,
You got them, but I brought them.
yes, which is, Hubbardston Center School. We had not gotten results back, in the past. We asked for them and we finally got them. And coliform and E. coli at the cafeteria, municipal building, bath sink, booster pump, and well number 1 tap are all less than 1 for 100 milliliters. On the test done on, since I'm talking about it out loud, what's the date? 11/4/24. And we also have a test result
It should be 1 through 12. 12 too.
in 12/2. Also done at similar locations and with the same results.
Do they test monthly?
It was my understanding that they should be testing at least 4 times a year minimum. And we didn't get tests prior to this, so we still need to go back and ask them for tests. So I'll quick pass that around.
It's just surprising that they have one November than December.
Right.
When the
And they
November
could be
one was
doing it
fine.
monthly. I believe
How
the
would we
guy,
know?
but we don't know because we haven't gotten them. So we still need to get test results prior to, November. Because we didn't get any earlier in the year at all, which we already asked for in emails. Did I write 25 or 24 on those other ones?
25 on this one.
Oh, good. I was-
know, I have checked myself as well. Yep, 25.
Okay, because I was about to write 24 on this one, and that would have been an oops.
Move this one slide.
Yeah.
Okay, so we still need earlier reports, but those two reports are great.
Yep.
Okay, next we have 23 Natty Pond Drive,
That's
well
just
water
an
update.
update. This is the one that they put the well in previously, wet in 23.
Oh, and it was coliform.
Yes.
Yeah.
So do we have a new water test yet?
No, he's gonna send that. That was just on the 7th.
Okay.
He said this, that's
There,
all.
okay, I'm just gonna read this one out loud. That we got an email that the liner was put in on Friday, but this email was on Tuesday, 1/7/2025. They've been flushing the system to make sure all the disturbed water is out. Once that's done, they'll get the water retested. Okay,
Okay.
so it's still ongoing,
Mhm.
but
We're getting updates.
yes,
This
we're
was
getting-
one you were having trouble getting updates to, right?
No, he's been pretty
Oh.
good about, yeah.
Yeah,
Needs
it's
to
just
be, right?
they only, it's a test that was done a long time ago, and there was no follow-up sink test.
Yeah.
We always do one at the, when they put it in.
Mhm.
No, there was no test. Was there?
I thought, well, maybe,
Maybe.
yes,
Oh, no, that's the, no, we needed a water report. He had the new well put
a
in.
new well put in.
Yes,
That's right.
and then a water
Too many
test
water
was not
tests.
done.
Okay, new well, no test. Okay. And for his benefit, he needs to have a test done.
You just wanna sign those.
I know, I'm gonna
Oh,
do.
okay.
complicating things a lot here. And this one I'll just initial, the others I'll sign. And then the next one is 125 New Templeton Road.
Yep.
First water test from the wellhead. Hollow
This is a
Farm.
new build.
And this is a new build, and it was both, things were absent. So I'm just gonna pass that around while I'm signing. Anytime you guys have questions, just speak up, because, we have a very long agenda, and so I'm kinda going through. What did
This-
you see?
This, I don't see anything, I have a question. Where, this is pass fail, this column here with all these green checks, so obviously those mean pass. Where there's nothing, is that just, there is no pass fail?
Yeah,
Quite possibly.
uh,
Like turbidity. Like,
Does it say anything on the line?
yeah, there's a result. There's just, it doesn't say if it passes or fails, probably because there isn't a level that they need to meet for
Maybe,
that,
right.
for turbidity, correct.
Yeah, and then calcium, there's a few of them.
Right, and the way that organization does their testing,
They're very analytical.
some of it is printed out based on what you paid for.
Okay.
So if they didn't ask for a turbidity, pay for the turbidity calcium levels,
Then it's just not.
then it won't be listed
Gotcha.
necessarily. That's a second factor in that company's reporting that they've updated. They make a full list, so I think people know
That
what
it's
you can
available.
test for.
Correct.
And then, cause that's who I use to test with, and never had any problems with them, it's just, yeah. But,
Thorough.
yes, it did, yeah, you can pay for different levels of testing. And that's basically true with pretty much any water test company, and I'm very familiar with that one with myself.
I don't feel like there were this many permits last January.
There's more to come too.
Yeah, I gotta get, okay, here's,
So you need to sign that.
yep. Okay, what do we got next?
25 Lombard.
25, Lombard Road with their second water test. Thinking about writing in cursive, they had on, one of the television shows that the National Archives is looking for people, to be able, that can read cursive, to transcribe things,
Yep.
documents from the last couple hundred years, to help them catch up, since nobody new, younger, can read cursive anymore. It just,
Wow.
here I am writing cursive. Maybe I should print. Okay, and this one is.
So that's 25 Lombard. So when she did the test, she did not ask, or somehow it wasn't sent back with this is from the
Yes.
one from from September.
Correct,
So, and they both were absent,
okay.
E. coli and coliform. This one doesn't have it. She didn't ask for it or something. So I don't know
And this is,
if you accept this, or I did email her and said that,
and the
we
first
needed
one
it.
was a,
He reviewed that one September tenth.
And so this is new construction.
Correct.
The first one,
From the wellhead,
wellhead, and this one,
that one's from the sink. But there is no testing.
yeah. Typically, again, the same company, does that automatically. If she asked for all these other things, yeah, we need it.
We need it, okay.
Mhm.
So I did tell her that, I would let her
Yes,
know.
so, 25 Lombard
All right.
Road, water test, they need to confirm that they did it. It's not, again, why did they not do that?
Well, like I said, they did it from the wellhead.
I know, but.
So if it wasn't there from the wellhead, could it,
Yes,
cause there is a water filter system on it too. I don't know, I just,
Oh, it was absent in the first one,
it
is
was
that what you're
absent
saying?
in the first one and the
it
wellhead.
doesn't matter, it doesn't matter. Things were then built,
Mm-hmm,
things were then added,
yeah,
cause the wellhead's here and the house is here and everything in the house, that's why you do a second test. To make
Okay.
sure that your system is okay in the house, that it's not contaminated somehow during the construction. And the softener system that's put in and, or whatever it all might be.
It's so interesting that they don't have it.
I know, I find that unusual. Why they didn't,
I don't know.
Maybe it's not the full report.
yeah,
It's what she sent me.
I'll be darned, they need that.
Okay.
Well, that's too bad.
I'm really sorry, but they do need that.
No, that's fine.
It's not your fault, Kathy.
I know, I just feel sorry that the folks have to go through more work.
Well, cause she wants to close, she wants to get in, she wants her occupancy.
And,
But that doesn't take long anyway to do
yeah,
that test.
they do that and they bring it to the office, I can
Mhm.
review it and then we can review it at a meeting later so that they can
Mhm.
move ahead. Once we have that result, I can review it ahead.
I'll let you know when you get it.
So, that's how we keep things moving in this town, as quickly as possible, so. We don't try and hold them up for a month or 2 months, which, and this is the most current report. I'll just hold that right there. Missing E. coli and coliform.
So interesting.
I
don't know what
know.
other word to use.
Yeah. Wait, okay. Alright, I'm gonna do my water test next week. I'm gonna make sure I make it very clear that it's all done.
Like there's testing for fluoride? Like-
Yes, oh yes. Because that's added to any municipal systems.
Mhm, right.
It can be. I mean.
I'm just surprised that they had testing for fluoride and not E. coli or coliform.
The other thing is you can add fluoride to your own water system with a special, another add-on to your water system, to have fluoride added in if you wanted to. Yeah, okay. So then we're on to wastewater tests. We
Yep.
have the Briarwood townhomes.
Okay, now that's the one they were supposed to send back within 30 days, that form they were supposed to fill out.
Right.
So I emailed them again,
Yes,
looking for an update, and I got this. So they're asking, they're unable to comply with some or all the corrective actions within the time frame specified, so they're asking for an extension.
What are the actions that
I don't
they
even
need to
think
do?
they knew they had to send this back to them. It's all in there.
Is this a
You've reviewed it
large-
before?
a large company? Or is it just they have a leasing office there?
No, this is the townhomes.
Mm-hmm. Oh, is it like an
It's
HOA?
I'm not sure.
I'm just wondering if they can't comply and want an extension, maybe they can give us a timeline of what they can't, just so we have an idea of when.
Table B had the deficiencies. Okay. They don't have individual meters on each source to measure withdrawal volumes from each individual source. Deadline was 12/31/24. To measure the water withdrawn from both well 1G and 2G. They couldn't verify the condition of the storage tank, but there's no deadline on that. Oh, 3/1/25.
Yeah, I think all of those have a deadline.
Deficiency citation number 3 was raw water source sample tap is located after treatment of source water in the event of an emergency requiring disinfection. The raw water sample is located after the emergency chemical injection port. So they need to put it prior to that injection port. When did they actually get this report? The
The first.
town, the first time the townhomes managers saw the report. When did they get the report? When did they get it?
October 21st.
It was done in June. They got the report in October.
And they just
Originally,
did
they
not do
gave them
anything.
6 months from the report to make the corrections.
But they had to return, please be advised that within 30 days of receipt of this inspection report,
Yeah, they were supposed to
they were supposed to sign
sign and
this
acknowledge
and
it.
acknowledge that they received the report and knew what they needed to do, but they didn't.
And they still haven't signed. Well,
This
this
is
is
my
our
copy.
Our copy.
I don't,
Right.
I'm assuming that that's.
So some of the items are due, March 1st.
That's what this
Can we
is.
ask what the barriers to them completing it are? Like, is it weather, or? Because why can't they do it in the next month and a half?
They just asked for an extension, right?
Yeah. I'll check into it some more.
I would agree to going to March 1st when the one citation is due, to extend it, because they also didn't follow up and acknowledge it, and then they really sent it in to us, and all of this became in October. So they lost 3 months of their ability to do things in a timely manner. So I think it's okay to give them an, because I don't see any of these items as being critical to water safety right this minute. 'Cause
What kind of extension are they asking for?
They didn't say. But I would only give them an extension to the one citation that is due March 1st.
There are ones that are due after that, so.
They're all, the others were due December 31st of 2024.
Oh, gotcha.
And I
Well,
would-
obviously they can't comply with that.
No. So I would suggest that we send them a letter that, the items in citation number 3 and 4 that were due December 31st, that we would give them an extension till 3/1/2025. They better come back with them by then. They're not that hard to correct. those are, for replacing the tank. The citation is to, there's a asset management worksheet that requires a revision. It lists the average life of a 1,000 gallon tank as 50 years, but the estimated useful life of steel tanks is typically less than 50 years. So, we will give, that was also due December 31st. Their revision plan by March 1st. And they need to have an inspection done of this tank by March 1st, of the water tank. And that should be all completed at the same time. So I think that's fair. Right.
So are they asking for like a blanket extension on everything or just the ones
That's
that
the
were
way
due?
it looks to me.
But we're not.
Right.
We're only giving them an extension on citation 3 and 4. That's what I would recommend to be a reasonable thing to do. Are you in agreement with that extension?
I just wonder why they're asking for one. I understand the two that were already, like, are overdue, but is there a reason why they can't do the other ones by June?
Oh, they should.
But I'm wondering on their end.
Oh.
You know what I mean?
No,
But who
they
cares?
need to do it for
Yeah.
DEP, or DEP is gonna come after them.
Right.
And you can we can just remind them that the DEP is going to,
It's my feeling that they didn't really ever
They're-
pay attention to this.
And they just
before.
felt like they had to respond to you, and they
Well,
said, I
because
can't
I've-
do this today.
We've
Because
been-
I've,
Yeah.
yes,
Okay.
right.
No, I definitely agree. I think that makes sense.
that's certainly reasonable for them to get this done, get it scheduled.
Mhm.
Gives them enough time, and they're all related, including the 6/1/2025. It's all related to the tank and the inspection that it needs, and I'll pass it around. Yeah, I signed it. Okay.
This just came in today.
You wrote 24.
I'm glad you caught me. I was afraid there was, oh, it was, yes. There we go. Sheesh, good job, I'm glad I'm passing this around.
So this is the fast system report for 5 Navajo.
Okay.
They had to have that, remember the one that, the house that was built that had to have the fast system put in? There was a note somewhere right there that they did something.
This email, I don't have any context to what this is about. I'm gonna
Hmm?
they wrote, I don't have any context as to what this is about.
Right, that's
'Cause they
why I
hadn't- yeah.
think they just passed over it.
And I'll pass this one that way. We'll cross it over. A fast system is not an ordinary septic. It has a tank system in it that
generates something fast, does something different.
Right, I'm not explaining it well tonight, sorry. It's a different septic system that, when you don't have a drainage field that you can use, and then it treats it, and then it goes to a tank, and it's pumped every so often, based on the size of the system. And it has to be inspected usually at least yearly, but some places it's even twice a year. But that, we don't have to determine that, that's determined by the inspection system company that deals with the past inspections.
They take up a lot less space.
Yeah, they do take up less space, cause there's no,
They sound more expensive, aren't they?
yes.
They are.
Because you have to have these holding tanks pumped periodically. Okay. We have a very long list of permits to be voted on. Not all the, on some of the kitchen permits and such, not all the water tests are in, so
And even some of the workers' comp and liability on some of the, we discussed that.
installers is not included. What we thought would be most efficient is to sign all these tonight with Nancy reaching back and saying, this is missing, as soon as you get this into me, then we'll issue.
Then they'll be all signed, that way I can just make a copy and send it out.
Yeah.
Okay.
However, of course, if there's a problem with the water test,
Right.
then we won't do it. You know, like if there's a positive E. coli, you know, we're not, even if we signed it, we're still holding it until we get the right water test results. But this will let us keep moving forward, without, but also making the installers, the licenses that, and permits that we're, going to sign, make them responsible for completing the work if they want their permits.
I'll get involved.
So, that way we can, and it's all noted, you know, you'll see on it, waiting for water report.
Okay.
Yes,
I got my little stickies too.
okay, so, what I'm saying is, if you sign this, we are approving this. You approve that we are doing this. You can take a minute, I've got two of them in a row.
Should we time ourselves?
And you can look at any portion of this as you go along, if you wanna review anything. And,
So you could make sure that if there's something that I'm missing,
yeah, we can also double check with her notes that it is in fact not there. Or if you see anything else missing. Basically,
that's it.
do you wanna do another one?
Is this at, the old goat cheese place?
Yes. Wasn't she gonna do a second one because it was done in September? What, were you gonna ask her for a second one?
That is the second one. Yeah.
Oh, excuse me, I missed that. No, the water test.
Oh, I thought there was, yeah, there is a water test in there, isn't
No.
there? Right here.
Oh, for goodness sakes, Kathy.
These permits last a year.
1 year.
Yes.
1 year,
Mhm.
got it.
Um. On that subject, I do plan to continue with food inspections, even after I get off the board for this throughout, for the
Oh, food,
calendar,
yes.
for the calendar year of 2025.
That's super kind of you.
Um,
This one is ready to go. There's no stickies on there.
Oh,
I
yes.
didn't notice anything.
Yes.
This one need, their, insurance. That one need insurance? And installing?
Workers' comp.
Workers.
No, this is the workers' comp here, right here.
Good grief, Kathy. Yeah, didn't read it.
It's okay.
I'm
Why
getting-
is
I'm-
there this stuff for a different company?
Because she's working out of Fitchburg.
Okay.
And they're, yes, they sell at Rieta Ranch,
Okay.
every week, or plan to.
And that's her name, but she works out of. that
Yes, and their
company.
kitchen is out of there.
Got it.
I know it can be really,
You must have learned so much.
I'm still learning.
And I'm still trying to keep up. Every once in a while, I'm looking right at it and then I'm like, where is this?
This one.
So the good news is, a lot of this has come in. Bad news is, there's still yellow stickies with,
No, that's not bad.
You know.
We'll get it done.
with things that need to be done.
This was a good plan though, because now they're.
Cause there's gonna be more and, you know,
Like mine.
like yours.
Next week, order test going in.
Alright, let's see, this one, a lot of these are gonna need.
It's okay.
Hence I brought mine.
Mhm. they get this all in the next 2 weeks, then they're set.
And they've already paid for their permits, so they're not gonna not send it in.
Right.
Right.
Mhm.
Everybody, when I have contacted some of the people, they're very nice about it. I'm just gonna put initials.
Yeah, yeah, yeah. Ah, yes.
And a lot of these have had permits from last year,
Yeah.
so.
Good news, there's a lot of people that wanna work here.
Yeah.
That's what that says, as well.
It's very positive, yeah.
He's in Gardner, so no debt is owed, right?
Correct. Oh, just put not applicable.
Filling that in. Okay.
Is that a tax thing?
Yeah,
Yes.
if they work in town, we just have to make sure there's
If
no.
they're resident, they have to have their taxes up to date. So there's a line that says no debt is owed for any business, like an installer and stuff. We have not required that of residential kitchens and such. But for installers and stuff, that is the state guideline.
Halfway.
It's
Someone
like
here
a
pulled
well-oiled machine.
yeah, someone sent in an older version, so I wrote in the expiration date on it.
What was that one?
This is, Lawrence Septic.
Didn't check it off.
Can't just find it on the pictures. Yeah, so all of these will eventually be totally online. And,
Does this one require an extra signature, or is that,
no, we're fine.
okay,
Yeah, that's fine.
there's only two?
Yep.
Okay.
Well, you can sign it
Can I-
below.
I can
Yeah,
below.
you can sign,
Okay,
yeah.
You can
got
add
it,
in.
got it, okay,
Again, they used an old form.
okay.
You can just pretend you're vice chair.
Yeah, no.
At least I think it's old. Is it, maybe it's listed,
It
maybe we
could
haven't,
be.
maybe we haven't updated it.
No, it is
Online.
updated online.
Yeah, so this is an old
Yeah,
form.
but they probably, that was back in 11,
No, but-
November.
Yeah, but this whole form with the dates and that the permit expires 12/31.
But they've been updated since this was done, since he filled that out.
Yeah, some of them sent them in quite early, which is great.
hauler is what? Septic?
So they have the big tanks on the trucks.
Oh,
And they
okay.
go and they pump out
That one's-
your,
The septic tanks.
the septic
Yes.
Okay,
tanks.
septic, okay, got it.
I added that
Oh, I put it up here.
in. Okay.
Oh, did everybody sign? Okay. That one's this one. Scotty's bodies, I miss that.
Do you file them in the way that they're listed here? Is that why you have them like, you put the new
No, I
ones
just
in?
wanna make sure I get everybody's back.
Yeah. I like your ways.
So I'm still waiting for $45, cause they sent it in,
Yeah,
you know,
that's before the fees were
right.
posted.
Next year we need to, if we're gonna update fees, we need to do it earlier. They haven't even finished doing all of the changing all the forms and everything.
Yeah.
Between being sick and holidays and it's just crazy.
That's waste management.
This is public. And so we need to issue. This in the back. Oh, it's there. I think. So that's the workers' comp. We need liability.
I have
Very little patience for them missing things, waste management.
Let them know they owe additional money to cause they did this back in November.
And we can ask for the additional money because it did not say 2025 fee schedule on the website. To see if anybody asks, it was not on when some of these were submitted. And we made the vote prior to the end of the year, and so additional monies are due in a number of cases.
sent it in, they owed the additional $45. Um,
This Galina's.
Oh, that's 'cause she signed it, I was just looking at that date, but it's because that's when she applied on that date, but the date down here is.
And then,
Do you guys have RM RADA checked off? Q? Do you have Q checked off? RM RADA?
this, the RM Rada Corporation, did you get that one?
Yeah, I have that one,
Okay. That, I was sure it was a Liz problem.
yeah.
No, I didn't check it off either.
Oh, you
I must have
didn't?
missed it myself, but.
Oh, now you're gonna make me look.
Well, no, this is good. Let's make sure. About 7 now, right here.
Good. Looks like my signature.
Okay, no open septic plans, no engineering plans?
No.
Okay. And then under old business, inspection report from myself. Two kitchen licenses were not inspected. I reached out to them a few times in December and nobody called me back and time disappeared and they weren't done. Rich Stevens from Rutland, he's the Rutland Health Inspector, he's also our backup for Phil Ledger as a sanitarian. He came and did my inspection, so we should be expecting a bill shortly from him for that. Going forward, I notified, after talking with Rich, he's gonna take over handling complaints for me starting February 1st. He is already approved as, the backup for, a sanitarian in Hubbardston. We just have to take time to settle what's a simple complaint and his fee, and what's, if he has to go out a couple times, what the fee would be. That fee will come from, two sources, this is the way I look at it. And I have to write up an SOP to make this easy for Nancy to know how it should be handled. If it's a food complaint, it'll still come to me, cause I'll still do anything related to food and food inspections, for the next calendar year of 2025, even though I'm going to be going off the board. The inspections after I'm off the board, I will be submitting bills for, which in the past was always $50 per food inspection. Up until then, the spring ones will all still be gratis, because that's what I do. So any food complaints will still come to me. If it's a septic issue, it'll definitely go to Rich. If it's housing, he may need additional training and go on the Massachusetts Train website to go through the online housing train program, but he does that for the town of Rutland already as their health inspector. He does the housing inspections, so it's not like he's not familiar with it. And he has agreed to take that on for us.
So he must be pretty much up to date anyway.
I assume so,
He's
but
doing it for
it's one of
Rutland.
those things that we'll just make sure he is, because I believe that's part of the new state guidelines that are coming out. Zoo permit application. Where it stands is that I actually reached out to, a staff person at Franklin Zoo to find out what kinds of licensing is needed. I could not find anything on the mass.gov site. And bottom line is tend to be federally registered. And also then, if it's all just in Massachusetts, then there's a special registration for, having animals that are native to Massachusetts, and that comes under, if I'm remembering correctly, I didn't bring that note with me, MDR registration. So, with, the place on Burnshirt Road, I have not done it yet, but we need to write and call them both, just ask them for what permits they have gotten. If they don't, then we'll be taking more action and stuff. From that point on,
Through the state you're looking for, right?
yeah, state and federal licensing that they have, or should have, depending on the animals and creatures that they, have at their, animal adventures. And those organizations would do, and there's a lot of reporting that they're supposed to do under those registrations. So we would ask to see some of that reporting as well. I'm thinking, and we can think about this some more, is that we should have a fee that will cover our clerk's time to make sure this is done that they're staying up to date every year. So there would be a permit for the town of Hubbardston under the Board of Health, to just verify that they're still maintaining all their licensing that they should have. Not that we're gonna specifically issue any additional licenses, but a permit so that the time that it takes for Nancy or whoever might be in the office doing that, it's covered. So my guess is, probably about $40 would handle, that. That would go under the revolving Board of Health account, and then, of course, part of that will go to the general funds, or most of it, depending on how we word it when we put it together here shortly. My timeline is to have this completed in the next month. Give us a month to work on it, hopefully, middle of February maybe. Any of that on the website and everything else, once we all read it, review it, and know where we and I'll bring copies of the actual registration documents that I was told about. I apologize, I didn't bring it with me so I could speak to it 100% based on what I was told. So that, we can do an online check that they did do it, or they give us a piece of paper that shows that they're registered up to date. One or both, so.
Don't they have alligators and
I think
all
so.
kinds of things?
Yeah,
I
so-
would think those should be federal.
Yes, that is a federal thing, yeah. Yep. So that's how that's done. I did find out
That's a lot of information.
what is done, and she actually had the gal I spoke to at the Franklin Zoo, actually had to look some of it up because they've been in operation for so many years. It's just like automatic that they know they have to do this, and they have the forms and stuff, but she was very helpful.
That's nice.
And I got very lucky that she had time to talk about that. So that's where we are on that. On the Hubbardston landfill well flush out or repair, I want to table. That does not need to be decided on until spring.
I have all on
Do we have, Oh,
That
you
was-
did give
that
it.
is- Yeah, I made a, you remember you made a copy, do you wanna
Okay.
see anything? Or do you think you covered it?
Did I make any mistakes? That's what I wanna see. They should have something from the CDC if the species originate from other continents.
The species, if the species originates from another continent or the actual animal?
The actual animal.
The animal,
Yeah.
yeah.
Like if they have a koala or something.
Yeah, you know,
Make sure it was brought over the correct way, maybe?
Yeah.
and-
yep, I got the MDAR is for native wildlife and, so we could reach out. They should have permits from MDAR for that. They use those. And it's called an exhibitor license. And it is, I said federal, and to be specific, it's the USDA Animal Welfare. Depending on the species, they may be required a federal animal species license if they could be a dangerous animal. Otherwise, they may need from Massachusetts a license from Fish and Wildlife. So depending if it's a fish or, and all of that. So
Each animal needs their own little license, then it sounds like.
potentially, unless you have a whole group of just Massachusetts native animals like squirrels and bobcats and all the rest, then the license primarily would come through MDAR. Okay?
Alright.
All right. So I did get a lot of information. Thank you. I'm going to ask that we hold off on Irene Cogden's.
Well, did you wanna do our problem? That's just a quick, just read that email, that little,
Oh, okay.
that was about the pricing.
Oh, right.
I thought it was maybe included, but it isn't.
Okay. On the well flush out or repair, that would not be done by Mark Popham's services. It would have to be done by a well driller contacted by the town prior to the next sampling.
Which I think he was talking about sometime in March. If you would, I think, if you read through that. So we should expect a bill. And I think
No, we
probably-
have to hire someone.
We have to set it up, right?
Yeah. Okay. Yeah, that's it. Let me mark down read aloud. Otherwise I forget what I've done. So we will have to get someone to do that. I'm just thinking, who might we ask in town business? Okay, Irene Cogden's proposal, what do we have on that?
I just have, this is what,
Did we get any information back from her at all?
not that I know of, this is the
Okay.
only thing I've gotten. This, and that's the Board of Health regulations, I didn't know.
Didn't we approve something already? Or did we just?
No, it needs to be approved.
What we wanted to do is add, some wording,
Oh, okay.
the wording
So we had
to
talked about what
our haulers,
But there is a form in there that we need to fill out and send back.
Okay.
I think it's in the very back.
of this.
Get that. I think it's on that page, yeah.
I would like to table this. I plan on meeting with Nate tomorrow, and discuss this some more with him before we move ahead. Okay? This is the only copy though, right, that we have of this. I'll get it from you tomorrow. I don't wanna take the only copy home and then have the cats chew it up or something.
I don't think Nancy was gonna let you.
New business, right to electric service notice?
Yeah, so Judy had sent this out, you had gotten a copy of it. It's
Oh.
just if somebody is ill
So,
or there's certain
yes.
criteria.
With winter here in full force, note the following from National Grid. Everyone has a right to electric service. And, one of the things that it states when they send this out to people is that during serious illness, contact your registered physician, physician assistant, nurse practitioner, or local Board of Health official, and have them telephone the company immediately, and then there's an 888 number. And, yes, just we'll pass that around to be aware.
But do you think we should put that somehow on the website, or do you think that's something we should do?
I think that would be good to have.
I do think it would be good to have it on the website, but yes.
Redo it or something?
Just that.
Just.
A note from National Grid, if you are having a serious illness, this is the action that can be taken.
Okay,
And then list that exact paragraph.
okay.
I don't wanna change their wording. That sounds quite reasonable, just so we're all aware. Would you email that to all of us, the entire board members too?
Mhm.
Because it doesn't say a specific board member, it can come to almost any of us, and the Board of Health office is not open on Fridays.
Correct.
So would you also
Mhm.
please email that to all of us? And of course, you would have to get their name, what's going wrong, what their diagnosis is, and their address, their home phone, all the basic information, before, who their physician is that's been treating them, why wouldn't the physician call in for them? I would always ask that question. Not that we can't do it, but I wouldn't do it without knowing why the physician wouldn't do that for them. Cause they know for sure that that person's been seriously ill. Okay. So, name, address, phone number, physician, diagnosis, what's their serious illness. And then why, if you're calling us, has the physician not helped you out in this situation by calling that 888 number? Okay. Not that we won't do it, but I feel, and write it down, take notes. Paper record. All right.
So you had, wanted everybody, you said this, you wanted them to come one time. at the
Yes, if they
recycling
could come
center,
one-
Cause this is the one that I had brought up before, they're
Mhm.
in Sutton and Westford, I think.
Right.
So I did email them.
So this is hazardous waste disposal made easy.
Yes.
And EDT,
Yep.
and she sent an email to them.
I said, could it be possible to do a one-day collection event in conjunction with our metal recycling day in the town of Hubbardston? if the $250 was paid, cause it's $250.
Mm-hmm.
And he said, Nancy, no, unfortunately, no, the $250 fee is for the minimum pickup charge plus the cost of disposal by the pound for picking up at an individual's residence home. An event would be thousands of dollars, if not more. It's not something we are looking to do.
Okay.
So they're saying residents can come to our collection centers and pay as they go, or we can arrange an individual pickup. But you have to pay $250 for them to come to your house.
Mm.
So,
But if it was something horrendously terrible, that would be a minimal amount of money. Not that anyone here in Hubbardston would necessarily have that. But maybe somewheres there's other towns, there's businesses that are working with materials that are quite hazardous. I don't see that as an issue in Hubbardston at this time. Okay, so that's not available.
no.
Yep, and I will be handling, general complaints, unless it's already open and ongoing. I'll finish up on whatever's open and ongoing, for right now. And then we will, ask Rich Stevens to do it. He has agreed to do that. So we need to, by the next meeting, we'll have a little SOP, plan of operation and guidelines. I'll put that together for us to, decide if that covers everything that we need for him and for our Board of Health. Does anyone have any ideas? Nancy forwarded the internship, program.
I do.
Good.
I think that we could probably use, and you can correct me if I'm wrong, Nancy, a intern to help with the filing and making sure that everything is in the files with the sheets that you've made.
Mm-hmm.
Like, that seems like a
Well,
job.
scanning
Scanning,
is
yeah.
really what we need.
Yeah, I
Yeah.
think just general office work like that, and they would get exposure to documents that, you know, it would
All the
be
documents.
educational for them as well, you know?
Mm-hmm.
Not super stimulating, but educational.
Mm-hmm.
Oh, come on, my job's so exciting.
Well, you don't just scan all day.
No, I don't.
Who is paying this intern?
It's done by the state. So
Okay.
they're in public health education programs.
Okay.
And we apply, and hopefully we get one for a few months, and they get credit,
Mhm.
and they have to write a report at the end.
And the state pays them?
It goes, yes, it's an educational grant kind of program.
And how many hours do they do a week?
Oh, what did it say? It didn't say.
I didn't even open it. I just remember that we talked about it last year too.
Yeah,
160 hours. MDPH will pay students for 160 hours of practical work through the Department of Public Health.
there we are, 160 hours.
Across like 4 months, probably.
June,
The form must be completed by February 7th. That's the information.
they're gonna accept 35 projects. And at least 10 are geared towards undergraduate community college students. Internships are from June 2nd to August 15th.
For 2.5 months, right?
Mm-hmm. And they break it up.
10.
It's usually, what's that, 3 days a week kind of thing?
Yeah, so it's about 15, 16 hours a week.
Yeah.
That's a lot of hours.
That is a lot of hours.
Mm.
So I would also, what we did in the past, let's see, when did it start? June 2nd. I also took the intern out on food inspections, so they could learn some of that.
Mhm.
We had this student make a display for the town fair on something regarding Board of Health activities. So that gives them some independence. If we need any studies done, think quick. So we had the last one do she prepared a online, like that you get from the Monkey surveys, and we did a survey at that time too. So we had a student, the intern, work on that. So those were the 4 things that the one student that we did have a few years ago worked on. Yeah,
Those are good projects though.
Yeah.
Mm.
When is the application due?
February,
I think it's on the other side.
it's due February 10th.
Oh, okay.
And then possible survey, possible health survey. Okay, so I have 4 different things I can put in the application. Okay, next, Mike Hugo is a legal advisor from the MAHB, which is the health board, of which we pay a small annual fee to be a member of, so that we have these services. He's coming to our January 28th meeting.
Oh, great.
This is really important that we all come. He will answer questions in person in regards to our ability to maintain our accounts as we currently operate them. He's also aware of our MPHN is the regional network out of Fitchburg that we have been members of. Some years including nursing service, some years just being one of the towns being part of the regional members. They have gotten a very big grant, and he felt that we would be able, as town, one of the 13 towns in that group, regional group, able to get some funds to do a couple things. And so he'll speak to that. Judy spoke to him the other week, and then I spoke to him as well to give him more history of our board, the size of our town, the makeup of our town, and such, so that he comes in with a better idea of how the MPHN monies, what he thought might be useful, might make more sense for us. So, in that regard, the fee for MPHN is a bit overdue. I think it was due in October. And we had tabled it because Judy wasn't sure that we would get any benefits from it, and I, at this point, would like to make a motion. I believe it's $550.
I think it's 600, it's on.
Or where is it? Do we have the?
Well, we're gonna, I mean, it's down here, I don't know if you wanna,
Yeah.
we do
What's
it.
the amount? So first is that we, motion is that we do wanna participate,
$600.
okay, in MPHN for, 2025. And the fee is $600 to be a member for the town. It's prorated based on our population. There's a basic fee, and then there's,
Yeah, it's 500 for the basic fee, and then it's an extra 100 for our town.
for our town, because we have such a small population. Phillipston's is also about this, small towns, Fitchburg, it's a big chunk, bigger chunk.
Do we remember what Judy's misgivings were?
The fact that, and I can verify that, when we were asking for nursing services and Mavering coverage, they claimed it was provided,
I remember
but
this.
we did not get reports from them that it was done. The only way that we know anything was done was secondhand through the back door from the state. They themselves never communicated, which was part of the agreement that we had with them. And,
So does this 600, it doesn't cover Maven though, right?
No.
Cause there were some like a la carte type things. weren't
right,
there? Yeah.
but this,
This is just to be a
it's-
member of the network, right?
Yeah, yes, and if they get any special grants for vaccine clinics, and a variety of things of that nature, then our membership will allow us to participate if they run a clinic for something.
Mhm.
And here's the list of additional things that they could do, that you could opt in, and the fee basis.
So,
So I'm gonna pass that for you to look at it as
do
well.
you feel like some of these, well,
I-
these are like the opt-in things.
Yes.
So,
The basic fee has always benefited this town. We have always gotten something for our money. Even before, we felt that we needed to have them do the nursing and Maven stuff, I would attend, they would have meetings. They were often near Westminster, which is kind of, was central, and I did attend meetings in person.
Mhm.
Then COVID hit and everything went Zoom, and it was much more awkward, but, and I have not participated in many of their online meetings. Would benefit from one of us taking time on Wednesday morning at 9 o'clock, and I forget whenever they're held like every couple, 3 months, and they review what's being done, what's available, what they're working on,
Mhm.
as to what might help us as an individual town. It's one of the things that Judy was listening in on part of the time. Before Judy took it up, we had,
Lori?
hmm?
Was Lori doing it?
Yeah, Laura, yeah, she was doing it, so, drawing a blank on names, sorry. Lori's doing it, and she was listening and then reporting at the meetings.
Mm.
And so typically a Wednesday morning at 9 o'clock kind of thing to listen in on. And you can actually, it's a Zoom where you can participate as well.
Mhm.
That's one of the changes, that's going, Mike Hugo will also go over all the state's Department of Health guidelines that are coming down with how they wanna have the same basic level of quality in all the towns. He's gonna review some of that too.
Mhm.
And that's where this may come and be helpful as well for our town. In the past, for that $600, we got clinics, vaccine clinics and stuff.
Can you remind me what your motion was?
So, my motion is to participate in the MPHN for $600 for the membership, which, is for, the fiscal year of 24-25. I don't know exactly when they ended. And that membership, that's all, the town membership in that organization.
One more question, so it's half over, the year is half over?
Yes, because I
Yes.
think
Fiscal
that was,
year 2025.
No, actually, they're doing it based on the fiscal year 2025.
yeah, so I think
So
that-
they like you to pay ahead to be
Oh, so
participate.
we won't be.
We won't be late, technically.
Well, we won't be part
Oh,
of it
this is
until.
fiscal year 25 already,
Oh, yeah, so it's
so
from-
we're halfway through.
we're halfway through.
Will we get, is it gonna be prorated? Cause we haven't been a member, right, for the last 6
I
months?
doubt they'll.
They won't prorate the 600, no. They,
Going forward, we have to remind to it when
in
it's
a
due.
timely manner.
But it's not as if we've necessarily missed out on anything, because.
As of right now, as far as I know, that is correct.
Okay.
The only thing they offered was to do a COVID flu clinic for us. And instead, we did one, Judy set up one with, the pharmacy in October to offer the shots at the senior center and, at no cost to anyone. And so we didn't take them up on theirs, but we were also behind on owing our membership in order to do that as well. That would be one of the ways possibly to set up another, COVID booster clinic in the March or April or something to help, cause it's still available and a lot of people still haven't gotten COVID boosters.
We could run two of them, at the pharmacy and Judy arranged, and then they can come.
A different date.
Yeah.
Yeah.
Get everybody covered.
One of the issues we had last year with them doing it is they had nurses that brought children with them
Oh,
and a dog.
I see. Okay.
So
Yeah, and that
we
was a
would be more
problem.
particular in the arrangements in the future.
Mhm.
That's a very expensive clinic, you know?
It does cover a lot of things. And they set it up completely at the center school. They didn't want any of our assistants. So that's why we
Yeah.
had hesitations.
I mean, what I mean is that would be $600 that we'd be paying for a COVID clinic, potentially, right?
Correct. But that's cheap, to be honest, because they're paying their nurses.
Yeah, but we had a free one in the fall.
Yep. The benefit is, if we pay this, there is probably, according to Mike Hugo, monies that may help us get a town nurse. So do we wanna, they really want the money.
Yeah.
They don't wanna, either we do or we don't. I guess I'm willing to gamble the 600 that Mike Hugo will help us get funds that they've been already granted by the state. And that's where I'm leaning.
Okay.
I believed what he told me, so I'm hoping that we'll join so that we can reap some of the benefits back.
My only hesitation is that it's halfway through the
I
year.
know, I know.
Like, what if those monies have already been distributed?
He said no.
Okay.
He said there's money there that our town would benefit from. So, yeah, it's a balancing act. We're not a big town. It's a fair amount of money, 'cause
Yeah.
it really hasn't gone up in 9 years more than $50 for the town each year, except when we hired other services.
I think it's a great resource to have. Really, literally, it's just that it's
Halfway through the year already, I
We're
know.
paying double for.
But if it gets us something for the second half of this year, we'll get our money's worth anyhow.
Yep.
I'm fingers crossed and being optimistic. I know, I don't have proof,
I like your optimism.
so,
We can hand him his check after he comes to meet with us.
no, he doesn't get a check.
Oh.
He's doing it through the MAHB, and that fee
Okay.
is only $250 a year,
Okay.
I believe. To be a member, to be able to use their services. And they're basically kind of like legal services that he's offering, but he's also offering other advice. He's on one of the state committees with the new standards that are coming out, so he'll update. That's my understanding of our conversation.
meeting though, that part of that meeting? If he's gonna be.
At least, I'd assume about an hour. We'll try our
So we
best.
should try to limit,
The amount of work at the meeting, yeah,
that was my thought.
yes. So do I hear a second to join MPHN for the second half of this fiscal year for $600?
I'll second.
All right, so we'll be optimistic that we'll get our money's worth. All in favor?
Aye.
Okay, it passes. I
I
know,
think it's a good idea, I really, really do, it just makes me,
I know, it's hard. We are so careful with our money that even $600
it's a lot
becomes
of
an
money.
issue
Yeah.
in trying to make sure that we don't have something else that's gonna come up for that. Thank you. There is one active complaint, and, the person making the complaint has contacted a lawyer, so I haven't actually visited the site, and waiting to see how it plays out with the lawyer. Giving him advice about someone staying in a trailer on his property without permission. He thought he was just going to be able to store trailers for a small fee, but, it turned into a different situation, and he filed with the police department, and he filed with the Board of Health, and since he hired a lawyer, letting that play out a bit more. So that's one active case. All right, we have, any unexpected subjects that anybody's aware of? I think we hit everything under the sun tonight. So we have turnovers FY 25-10 for $1,050 and F 25-11 for $1,560. And,
I didn't get a chance to break them down.
okay, this is just a total amount, going in, but not the portion that stays with each account in ours versus what goes to the general fund. And these are all the fees that were collected. So that's what these are. These are all the fees.
This is so heavy.
Because it contains copies of everything.
I made copies of the checks.
Feels like
and-
it's like quarters in here.
But that way we have a permanent record of the checks,
Mhm.
not that they get lost, which before Nancy came in and Judy and I were covering when we had nobody, a couple checks got lost.
Things happen.
We had made notes, the receipt forms that you see, those half sheets were done, and we don't know where the checks went. But we had signed off that we had received those checks, we had to give them credit. I don't know, we're never able to find them. So that's Nancy's way of, double checking that everything is there. All right, so we have those for deposit. And then the next one is,
So I did the two, remember, we
Yes.
talked about it?
there's,
Just say we're gonna go through with that,
Right,
so the
so
top one
there's-
is the one you wanna sign.
so the top one is the most current, one with the MPHN membership. That we just approved.
You're very optimistic.
I did two, I did one without it and one with. So this will come
Oh,
out of.
MAHB is only $150 a year, excuse me.
So that will come out of, our,
What did you think it was, 200?
I thought it was-
Oh, 250.
That is a bargain.
Yes,
For
it
him
is.
to come here,
Employees-
even just for him to be
employee
here
support.
next week, like.
Yeah. Okay, I have to sign some more, right? Or
just
just
at the
review it?
top, just, yeah, just review it.
Starting to get tired, sorry.
You guys all,
Oh, I do have one.
did you sign it?
I just did, yeah.
Okay.
Yeah.
I do have
Is
one,
that-
unexpected
Mm.
subject.
Is that
I'll
the
take
right date?
1 minute.
The 24th, the 25th?
Oh,
We
no.
wanna put, all right. Catching those
I did it.
2024s.
16, 25.
And I did think of one, unexpected subject. Generally in January, and I guess we'll have to table it till next meeting because I can't vote, and so therefore there wouldn't be a quorum. We reapprove the inspectors for the town that we have. And that would include my, Board of Health, being a Board of Health inspector. And, so we'll have to table that till the next meeting. Okay?
And don't you have to vote for chair and vice chair too?
That's June 30th. Chair and vice chair changes at the end of the.
Oh, okay.
So chair and vice chair offices change at the June 30th with the fiscal budget, because that's also when, if, like myself, I'll be going off the board, that's when that happens, June 30th. So that's a June 30th
Okay,
issue.
okay.
But for inspectors, it's a calendar year, just like any of these permits. And that's a January issue,
Great.
okay? And I believe that's it. So,
Did you wanna go over any of those account balances too? I gave everybody a copy of, they starred the ones that,
very quickly, yes. Start. The statement ending 12/31/24. The ending balance for the BOH revolving account is currently $20,877.43. On the next page, the recycling revolving account, the balance is $3,147.24. The septic revolving account is, currently minus $831.25. We did not still get the monies back.
I think we did,
We did.
it looks like we did.
Okay, we're gonna double check on that tomorrow. There was monies that we were supposed to be reimbursed for that, back into the septic, because it was all going to the town versus what we needed to pay our sanitarian. And so there was a figure of between it was either 11,000
something.
11,000 something, and that was supposed to go back in this fall. The $5,218 is to pay for.
No, that's what was currently in there and then expended was $6,050.
And
So the balance is a negative $831.25.
the 5,000 though, wasn't that to cover, most of that to cover the lawn mowing and Mark Poppins bills?
No, the allocated money is what is the balance.
Okay, I'm getting tired, I really can't keep it straight. I apologize, we need to have a further explanation.
Yeah, we'll go over it and then we can explain it later,
And then
next meeting.
the last page is the Title V, which is the septic loan program. and
Didn't somebody take a loan though? Shouldn't that be lower?
That's with the,
one loan out.
How come it doesn't say expended though? Was that before July?
Yes, he got his
Yes.
grant before July first.
yes,
I feel like it was
And-
like yesterday.
I know, it was last
Spring.
early spring.
Early
Really?
spring, yeah. So we have one person that has a septic loan through our septic loan program. And, as of the December tax bill,
Yeah.
it would be automatically added in for him to start making payments.
So soon we should see some
Increase.
increase in this.
Correct. And those funds were a dedicated fund many years ago, and slowly, we've helped people over the years. The individual that we approved the septic loan to, it was for $50,000, 52, yeah.
He had to have the trees taken down.
There was a lot to redo his failed system at his property, and he didn't have enough money. And to try and get a short-term loan to do that's very expensive right now. We do get interest on the account, but it's quite reasonable. And those are our accounts, so now you have a copy of all of that. Thanks, Nancy.
And that is sent out as well to everybody in town. Did you get it?
I don't get the emails.
Oh, you don't?
But my husband does.
Okay. Anything else? I think, the kitchen sink is still in the kitchen.
So the next meeting date?
Will be January 28th at 7 PM here in the Slade Building. And we will have a guest speaker, and I invited Nate to the meeting, and he is currently planning on attending. So we all are on the same page about a lot of this information. So it'll be a great that part was, I almost consider as a workshop. And the first of a few to come in workshops, because I've been on the board for a long, long time, and I know the ins and outs, but we need to share the ins and outs with everyone else that's newer on the board, so that the next person coming in may not know that either, and you guys can lead the way and share it. I was part of the board when there was only 3 members, and so, we each took a huge amount of responsibility at that time, when we were a 3-member board for 3 years plus. But I think a better operation is to share the information more and spread out the responsibilities a little bit. So I'm hoping that we'll have, this is Mike Hugo coming in is gonna answer us some questions, but it's also gonna be like maybe the first of a few little workshops that we'll need to have, so that everybody knows where everything is and what, and how it's filed, and just so you have a better picture in your head, because that's half the battle with doing this committee. And we are, a very important committee in the town, and you'll hear that from Mike. So thank you again for coming. And what is the correct time?
9 o'clock.
So I call the meeting, I adjourn the meeting at 9 PM.